how do you relax when you have so much that you have to do, you know? So I think it was kind of nice to kind of see that side of health psychology.
So how do you tell somebody to relax about their business if they're self-employed and they have to make it work so that they don't have a heart attack?
Yeah, it's just really interesting though to see how like what stress really does to you, you know, like the accumulation of stress.
From day one, from the moment they get accepted to the Wright Institute, they're put into a placement and they begin working with people.
For some reason, I put in that I wanted to be in a jail, and lo and behold, my first practicum was in a jail. I could still remember walking through the hallways and feeling like I didn't belong, but it turned out to be one of the most rewarding experiences of my life.
In my own case, I loved reading and learning about the personality disorders. I get a client who is a textbook case of a lot of them. These disorders exist. People with these personality traits exist. We're still in the classroom, we're learning, we're developing our skills, and then to actually go out and do it. That's what I actually found fascinating.
It's amazing to be in front of somebody and to know their life experience. I was at the jail last year. A lot of my cases were high-profile cases, anywhere from first-degree, second-degree murder, and being able to fall witness to their story and just being present in the room with them, something that they probably haven't had, is tremendous. And looking back on it, I feel like it's completely shaped my future studies here.
When you consider all of our students, how many people get services who would never get services. We provide to the jails, to community mental health, to the schools, to addicted populations, and it's all free.
In the schools that we work in Oakland, here in California, there's systems that are so stressed. The teachers are stressed, the principal's stressed. A lot of our schools are in our communities where there's lots of violence, families where there's poverty. Our students, I think, come out feeling very competent, working in multi-layered systems.
Being placed in practicums and sites where people have the most need for mental health, I think that has allowed me to discover a passion for serving people that wouldn't necessarily have access to therapy.
He has a lack of stable housing, problems related to the legal system.
How about the cultural factors that would contribute to a formulation? You know, the expectations of him, he lived in foster homes, poverty. The Wright Institute doctoral program is based on a case conference model. We talk about training issues, things that come up in their placements or with their clients. And the third hour is usually devoted to a case presentation where one student presents a case they've seen over time and they learn from each other.
It is possible that his anger towards his father is amplified by his feelings of anger towards what he has become.
So what would you say, from a self-psychological perspective, is his mistreatment of himself in terms of his health?
I think it's neglect.
It's a brainstorming, and I can't emphasize enough the process that goes behind it. What's important, what do you want to highlight on, and that's something that, you know, case conference really allows for. It's almost like a puzzle, I feel like, trying to pull all these pieces together of someone's life experience, right? This isn't a field where this is the answer. It's a matter of being collaborative and working with people.
The case conference really helps to illuminate some of the things that you're missing, because sometimes you get so involved with the client and there's so much going on that it's hard to look from an objective standpoint.
Yeah, I chose this program because of the structure of support. I knew coming into it, especially when I interviewed, that they're not trying to weed us out. It's collective and collaborative, and everyone is coming for the same goal. No one's competing with each other.
What do you think he is gaining, though, from trying to come to therapy and being in therapy with you?
Get the benefits of custody of his daughter again.
What makes the Wright a great institution is it not only provides you with professors who know about the subject, but it provides you with supervisors around the area that can help guide you.
It's you and an experienced licensed psychologist talking about your cases. And it's all for your personal development as a therapist and for you to actually help your client.
Looking at the Wright Institute was just a really personal experience for me. Something that really stood out to me was the professors and their backgrounds, multicultural, very clinician to society, which is the motto at the school.
All of our faculty members practice outside. It's an applied program where you really are focused on a model of seeing patients.
We will teach every student who comes here how to be a superlative psychotherapist, but we really want them to also be clinical leaders. That is, people who want to direct programs or supervise or teach or have some role that shows leadership in clinical performance.
So by the end of the year, the hope is that students use what they're learning in classes and what we're teaching them, and then the actual clinical practice, and they have an idea of what they want to do for the rest of their lives, but also how they want to practice and what values they want to express.
What really drew me here was the atmosphere, because I felt like it was really one-on-one attention, and it's a very warm building.
I think that the community feel of it allows you to make mistakes and makes you feel that it's okay to make mistakes.
Finding out that in my first year I would already be kind of thrown into the field, that's actually what attracted me the most.
I wanted to be the kind of clinicians that the Wright Institute professors are, and I could see myself in that role.
It's an integrated experience because I'm working directly in conjunction with the medical providers. That is actually the model that society is trying to move into, and I think that puts me ahead of the curve.